So, as a new Band 7 within the department, it's been very interesting to be involved in the clinical accreditation process. Obviously our journey from Silver last time when I was a Band 6, this has allowed me to identify areas we need to develop, areas that we do really well in, and it's also allowed us to reflect on our experience from COVID and things we can put in place in future to improve the overall department as a unit. And also it's made me realise how efficient we are as a team and how fabulous it is to work with all of these people.
On critical care, we have really good teamwork. When we have a challenging situation, everybody chips in and works really well together, and there's always somebody there to support you.
Good morning.
Good morning, hello sir. My name is Chester, I'm your nurse. How are you doing today?
I'm doing so well, mate, thank you.
Alright, that's good.
I'm just playing 14 to 2.
Alright,
If you don't mind.
yeah, we'll ask someone to get that for you, okay?
If you don't mind.
Alright, no problem.
So in intensive care, we work part of a team, and as physios on the unit, we're a really big part of that team. We often do a lot of the different things that you wouldn't expect a physio to do. We are here to help the patients, and we also have staff. We have a multitude of skills, all with the same one aim of helping to get that patient back to function. This has been really shown in COVID quite significantly, and we've all experienced that as a team together and pulled through it to get the very best of care for our patients.
So on intensive care, we're always looking to improve patient care. One of the incentives we've brought up as an MDT approach being led by physiotherapy is more focused looking around rehabilitation after critical illness. Following on from the COVID pandemic, we've started to introduce critical care rehabilitation boxes. Now these boxes are individualised to each patient. They include functional activities games, whether it's crosswords, word searches, also looking at an approach from the patient being in bed, assessing the range of movement and the muscle power. From this, each patient's got an individualised rehab box which has different components, i.e. pieces of TheraBand, grip strength balls, little bits of equipment like that that really sort of home in on giving the patient an individual exercise programme so they can sort of return to normal function as soon as possible. But like I said, it's all individualised, and we try and include the patient in it as well. So the nursing staff are trained on how to use all the equipment, the doctors are aware of the things that are going on. Obviously, like I said, it's physiotherapy led, but we get our therapy assistants and other staff involved in as well. Anybody that's coming and volunteering on the unit or students, we're sort of spreading the education around everyone to make sure that patient care is at the focal point of what we're doing on the unit.
I am so proud to be part of the critical care team in such a horrible situation that we've had over these last few months with COVID. We've had our lovely bus that came that we could all relax on. We had a lovely zen out room that we all could go and relax in. We've also got Cake Friday from one of our senior members that bring them in, which is a lovely suggestion. And I'm just so proud to be part of the team. We're very well supported by our managers.
Hello, I'm Lorraine and I work in critical care. I'm one of the senior members of the team, and welcome to our chill out room, our zen room as it was called. And in here it gives staff the opportunity to come and just take 5 minutes to relax and refocus on what they need to do. Sometimes it might be simple as they need to send an email, and that can be in the back of the mind all the way through working, and we get involved with so many members of the MD team so that when they're coming here they can refocus, and then they'll go back to the email, and then they can be a productive team member and getting on with the rest of the day's work. In here we have some laminated prompts that helps them to focus on their breathing, taking notes of their feelings and making plans for the next break and what they need to do now. We have soft music, and they can change the CD. We have some mindfulness music, and we have a room spray, so if people want a little bit of nice smelling fragrance, they can. We also do a debrief once a week, and that's open to everybody from domestics, HCAs, the doctors, nursing staff, and we talk about incidents that may have happened on the unit. We've had a challenging time and how people have coped through COVID and how we can manage it better. Also, I sent a survey out asking them how they cope with the face masks, and we're still working with that to encourage staff to alternate what masks they're wearing, making sure that they're taking regular breaks and having been hydrated. We also have an information sheet that the camera room may not be for them, but it's encouraging them how to go for walks, having a bath, and just having time out reading a book and just finding something that helps them to relax and refocus on what they need to do. Also on a Friday we have cake day, and we just bring a selection of cakes in just to say thank you to the staff for all their hard work. And some now regularly request to work a Friday just for their cake. Okay, I hope you've enjoyed seeing our Zen room. Thank you.